afternoon, viewers. It seems that we're going to be speaking about pain in our arms this week, and we're going to be talking about a range of different things, such as your T4 syndrome, your scalene syndrome, whiplash, those type of things, and sternocleidomastoid. So they're basically neck injuries that cause pain down the arm or pain into the face. So watch this week's videos. They should be interesting if you're complaining of those, so that you can try and identify which area of your body has been compromised so that you can get treatment for the right area, because history is everything. If you know where your history starts and which area is painful, then we can get the diagnosis correct and actually help improve the recovery. So today we're talking about pain down one arm. Usually it's one arm at a time. Sometimes it can be both arms depending on the nature of the injury, but generally it's one arm. It's usually pain in your bicep area with maybe a bit of pins and needles in those three fingers, or pins and needles in those three fingers and pain in those, we can get it right, pins and needles in those two fingers with pain in those three fingers in your snuff box areas, which we call it. So we'll get pain biceps, triceps. Sometimes you can complain of pain on your thoracic region here, just on the inside of your shoulder blade, and occasionally pain on your chest region here. Now you can have all the areas of pain or just some of the areas of pain. Often this one on the shoulder blade that I showed you here, where my hand is, if you've got pain there, then it comes from the area that we are discussing today, and this area is called scalene. Okay, so your scalene is a muscle that sits in the front of your neck here. It originates from your C3. Remember, we spoke about the different areas of your body. So C is your cervical region, T is your thoracic, L is your lumbar. So we're talking about cervical today, or cervical, and it comes from your teeth, C3, 4, and 5, and then branches down and attaches onto your rib, your first rib and sometimes your second rib, and then through it you have your nerve supply. Your brachial plexus runs through it, which supplies the entire arm. When this muscle, it's a very small muscle, when it gets activated, it will press down on this brachial plexus, which will then cause the pain down your arm. Like I said, your biceps, your triceps, down your forearm into your fingers, with numbness of those two fingers, and pain over your thoracic region here, and occasionally into your chest in the front here. So a lot of people, especially if it's down the left arm, will think that they're having a heart attack, but it's not that, it is just your scalenes. So to do a quick test, one would ask the people to put their fingers, keeping your knuckles straight. You would put your fingers down so that they touch the palm. If your scalene is affected, all the fingers will be away from the palm of the hand, so I'd be able to get my fingers under the fingers. If the scalene is touching, it is, well, if your fingers are touching, then scalene is not involved. If you have, like in my case, where one finger isn't touching, it's not a scalene positive test. I've actually had an injury to that finger, so it no longer functions properly. Or if you've got trigger fingers, your knuckles won't touch. If you've got problems with your palms, carpal tunnel syndrome, your fingers might not touch. So, but that's a quick test to do to see if your scalene is activated. Now the scalenes, it's very interesting. The history would be often in your gym, guys, where they've been doing arm wrestling. If you've done a heavy pulling action or a pushing action. So I had a patient, I've had several patients. One guy had done arm wrestling in the gym with somebody. Another guy had been lifting heavy boxes that he wasn't used to lifting. Another lady, which was bizarre, had taken her Christmas gifts and swept them off the table into a bag and activated her neck. So again, it's not that common. I've only had a couple of cases, but it does get activated, and often it can be activated after a whiplash injury. So therefore it actually makes it more common, because there are many, many whiplash injuries. So your whiplash injury will usually activate your sternocleidomastoid and your upper trapezius, which is the muscle on the back of your shoulder here, as well as your scalene. Those three muscles usually work in tandem, and they can cause huge havoc in the body. Now, it's quite a little difficult muscle to decrease and deactivate, because of the area that it sits, that it's sitting here and it's crossing over your lungs, and so it's difficult to needle it, it's difficult to get to it. But the stretch that you'd want to do for this one is just taking your head to the side. You'll feel it will be quite stretchy down there. You can put your hand behind your back. It's very similar to your upper trapezius stretch, but we're just wanting to loosen it up here. And then the physio will actually go in and work in the area here. So if you actually had to push in to your cavity here and push down there, and you get the symptoms that you're complaining about down your arm or in your chest or in your back, then you have also a positive scalene test, and that's the area that needs to be treated to deactivate the symptoms that you've got. The other important thing that you'd need to do is you'd need to elevate the arm. So it would be quite beneficial maybe to wear it in a sling for about 5 to 7 days just to take the pressure off, because it will also be activated if you're wearing a heavy coat, if you're wearing a heavy bag on that side, if you're carrying heavy things, because your arm pushes down and then the scalene gets stretched and then compromises your brachial plexus that supplies the arm. So at night, if it often will wake you at night, so you'll get into bed and then the pain will wake you and then you won't be able to go back to sleep. So what you'd need to do is you'd need to elevate the arm. So we often suggest to the patients that they must sit in a chair with armrests so that you can put your arms on the rest so that you can rest them there, which lifts the elbow up but takes the pressure off your scalene here, which deactivates the pressure of the nerve supplying the arm. So that's why a sling would work as well. So you would elevate the arms, wait for the pins and needles to come on, wait for them to go away again, and then go to bed, and then you should be sleeping fine. So then avoid your heavy coats, avoid heavy bags, avoid lifting, your pushing and your pulling actions which will activate the arm, and give it a good rest, and then go for treatment. Loosen your neck up by doing your stretches on a regular basis every 2 hours, and that will deactivate the pain in your arm. Scalene is a nasty muscle to treat because of its area that it's in. It's not impossible, but often it is missed because its location is on the front of the neck, and a lot of people focus more on the back of the neck and the thoracic region instead of focusing on the front of the neck. So go have a look, see if this is one of the areas that you find it compromised. You can go and do those exercises that I've suggested. It will decrease the pain. Heat also works wonderfully. So put a nice hot pack on the front of the neck here, and it will decrease the arm pain that you have. Good luck if you've got the scalene problems, and you can retest it again. As the scalene improves, so will your hand function improve, and then you'll be able to get your fingers down to your palms. Remember, keep the knuckles straight. So don't do that. It must be a knuckle straight and just the fingers coming down. So thanks for watching. Subscribe and like. Watch the rest of the week. We're going to be talking about all kinds of neck pain and causing arm pain and face pain. So if you're struggling with those problems, have a look, see what we've got to say. Good luck with your problems. Thanks. Bye.